When I work with patients, I look at it really as a partnership. I don't look at it as I'm the doctor and I know what's best. Instead, I look at it as we're a team working together to come up with the best treatment options.
When I think of recovery in schizophrenia, I think of really two things. One is the management of the symptoms, but the other is having a reason to get up in the morning and having activities and relationships that are meaningful.
I'm Dr. Roma. I am a psychiatrist. The majority of my time is spent in the community with my patients, working on their recovery.
My name is Javier Amador. I'm a clinical psychologist, and I specialize in schizophrenia both in terms of my research and clinically.
My approach to treatment has a lot to do with the therapeutic alliance. By that I mean developing trust, developing rapport with my patients. When I meet them for the first time, I'm not trying to make a diagnosis. Instead, I get at, where do you want to be?
I have a program called LEAP. It stands for Listen, Empathize, Agree, and Partner. It sounds simple and straightforward, but it's really very specific, strategic communication tools. The difference between LEAP and the doctor knows best or the father knows best approach is that rather than telling the person what their problem is, we listen first. We find out what the person wants. We respect their perspective, even if they say they're not ill.
If I can find some kind of common goal, whether that's I want to stay out of the hospital, or I want to get a job, or I want to move out of my parents' house, if we can find something common to work on, I don't get into the argument with them about whether or not they have schizophrenia.
We don't have a cure for schizophrenia, but I'll tell you, we have so many tools to make the lives of people with this illness so much better.
The treatment of schizophrenia is really multifactorial. I think the mainstay has been medication. People with schizophrenia often need to be on multiple types of medications. There are typical antipsychotics, atypical antipsychotics, but medication alone is not enough. We want people to be on the minimal amount of medication to treat their symptoms. We want our patients to be living meaningful lives. So that includes vocational support, social support, integration into the community, therapy for dealing with residual symptoms, and a wellness plan.
With education and some minimal, just common sense advice, you can give people tools to engage somebody in treatment.
One of the unique things that we do in the community treatment team is one of the members of the treatment team is actually a peer. And this is such an important role because the peer can help those who are struggling understand what it's like to be working full-time, to be taking their medication, can truly speak to them in a way that other healthcare providers cannot.
When I first think of the most important element, I want to say it's medication, but it's not. It's ownership of the medication. It's wanting to be in treatment. And for many people, especially those who lack insight, they're in treatment because a loved one or a psychiatrist they respect thinks it's a good idea.